Okay, I would like to welcome everyone to this webinar, 4 months on essential workers and the pandemic, which is organized by the Center for Migration Research at the University of Warsaw. And before we start, just a few technicalities. We have 1.5 hours for this webinar, and we have 4 speakers, and each of the speakers has 10 minutes. Each of the speaker has 10 minutes, and after that we will have a discussion, a question and answer session. But I would be very grateful if you could actually pose your questions via the chat, also during the presentations, and I will later on select probably not all, I won't be able probably to ask all of the questions, but I will select a few. If you could also ask, please write down in the chat to whom the question is directed. That would be great. And now, without further ado, we will start. And I would like to Elizabeth Pellerito to start from the University Massachusetts Lowell. And I would be very grateful for you to share your thoughts on essential workers and the pandemic.
Great. Thank you so much, Marta, for having me. I'm very happy to be here. My role at the university is that I'm the director of the labor education program. So I'm not a researcher. I work much more in the organizing world, organizing trade unions and teaching people in trade unions and workers how to organize for their rights. So my thoughts will be more from that perspective. I mentioned for those who were on early that I have a PowerPoint that's not hard data. It's more interesting photos to look at instead of my face. So I will go ahead and begin. I want to explore this category a little bit of essential worker in an American context. And in order to help us understand some of the campaigns and activism and workers' rights that have happened here in the US since March. And then I want to speak about the connections between the pandemic, workers' rights, and the recent uprisings in the last few weeks around the US about racial justice. So in an American context, I think most Europeans know that US healthcare is bad, but maybe you don't know in what ways it's bad. So I want to spell that out a little bit. For us, basic healthcare is tied to your employment. So when you get a job, your employer also pays for some or all of your monthly insurance costs. And a plan can be quite expensive. So I am a state worker as a university employee, and my lower end plan is $600 a month, and my employer pays for 75% of that cost, and that doesn't include things like medicine, doctor's appointments, treatments, anything like that. If I didn't have a job, I would have to cover that cost on my own, or I would end up paying most of those costs out of pocket. Or what most people do is I just wouldn't go to the doctor when I'm sick, which maybe has something to do with why the numbers of COVID-19 in the US remain so high. The other thing to note is that US labor law has some huge loopholes that allow employers to skirt kind of major federal labor laws by declaring employees to be independent contractors, and it excludes large categories of people from basic rights, including professions that are historically done by women, immigrants, people of color. And we do have more progressive laws at the state level, but not every state has those. So it's kind of a patchwork mess. And full-time employees who have several different employers, so for example, someone who does care work or an adjunct faculty member who teaches one course at several different universities, may not have access to healthcare through their employer. And we've had some improvements with that, with what is known as Obamacare, but there's still a long way to go. So in the context of COVID-19, when everything shut down, we saw very different treatment of sectors of employees. So most white-collar workers were working from home and continuing to collect a paycheck and also their health care. And blue collar workers were in one of two different situations. Either they continued to go to work, thereby collecting their paycheck and staying enrolled in healthcare, and often children and spouses are on that person's healthcare plan. So really healthcare for the family, but also exposing themselves, right, to health risks, to COVID-19, or they were laid off or fired for refusing to come to work if they wanted to protect themselves or family members. So they didn't just lose income, but they also lost their health care. And sometimes we even saw this happening at the same employer, where some public universities, for example, here have allowed professional workers and faculty to work from home without any kind of penalty or expectation of reporting. But cleaners, for example, were expected to report daily, not given masks, not given any protective equipment. So in the context of the American healthcare system, this is really a lose-lose for those employees. And on top of that, we see that at the lower end of the pay scale, many workers don't have paid sick leave in order to take care of themselves or their family members when they're sick. So if you travel to the US, remember that the person, if you want to go to a restaurant, the person who serves your food and the person who cooks your food probably doesn't have paid time off if they get sick. And you can see here this chart that I pulled from the Pew Research Center. Lower income workers very rarely have access to paid time off. And at the higher end of the pay scale, you can see that almost universally, folks do have paid time off for sick leave. We also know that in the US, we have seen very disparate health impacts of COVID-19 by race and ethnicity. And here you can see a statistic from the Economic Policy Institute. Black Americans are 12.5% of the US population, but account for a much higher percentage of deaths from COVID-19. And there's a few reasons for that. And I think that it does have to do with work specifically and social class more broadly. Because the US as a political formation and an economic entity has been formed really on the subjugation of Indigenous, Black, and Latinx people. Our class structures are largely, though not entirely, drawn on lines of race. And this particularly tracks who works in what type of profession. So the lower paid professions, as is true in Europe, agriculture, care work, retail work, are dominated by immigrants and people of color. And even here in Massachusetts or Michigan, where I'm from in the north, we have large populations of Mexican workers who follow the harvest season north. They live in trailers in the fields, often without electricity or running water. It's very difficult, dangerous work, physically dangerous. And these workers are subject to racial violence and sexual harassment and sexual assault in the fields, and they don't qualify for benefits or social services. So it really is a matter of work until you get sick to provide food for everyone in the country, or your entire family is going to suffer when one of you gets sick and can't work. So I wanted to talk actually for a minute about meatpacking plants. This is a really politically fraught workplace in the US. And this is an example where we have a category of workers who are being categorized as essential as a way to both signal a kind of racist political dog whistle and a way to attack their rights. So meatpacking plants in the US are very notoriously staffed largely by undocumented workers. And they've been the target of immigration raids for the past 20 to 30 years. But the employers themselves don't get punished for hiring undocumented workers. It is the workers who get deported en masse, and then the companies hire a new batch of undocumented workers, and the cycle continues. So again, this is a workforce that's doing very dangerous work. It has very high accident rates, high suicide rates as well in the plants, inadequate safety precautions. The buildings have very poor ventilation. It's impossible to social distance, and the employees are making bottom rung wages, and they have very little health care or sick benefits. So this is sort of a perfect storm for COVID-19, right? And this is why it's not a coincidence that at the end of April, Donald Trump issued an executive order, the only kind since the pandemic began, declaring meatpacking workers to be essential employees, and these factories must return at or near full capacity. And so, like many of the current administration's actions, this is really more of a political dog whistle than any kind of statement about food production or anything that is actually essential. It's really a way to say safety standards don't apply to these immigrant workers, and a kind of coded racist language. So it really is kind of, it's more about using the essential worker name in order to attack rights and ironically to declare these workers as less than whole humans, really. I won't talk about domestic workers here because I know Anya will be covering that. But the third sector of workers in brutal conditions, oh, I'm running out of time, okay, that I want to just briefly mention is prisoners. So the US has one of the highest rates of incarceration in the industrialized world. Prisoners make pennies per hour, and many of them work in manufacturing. Here I've put, this is a company that is owned by the state. The labor is done by prisoners, and there are incentives for cities and school districts to purchase from these employers. And again, this is a condition where our prisons aren't clean. There's no social distancing, very difficult physical work. They're not being paid a minimum wage. They don't have adequate mental or physical health care, and they're at very high risk medically, many of them. So I will move forward and just say as a conclusion that there is a growing movement to think about not just COVID-19 as a pandemic, and I apologize for the language on this slide. I hope that's okay. I didn't clear it with anyone. But so not just thinking about COVID-19 as a pandemic, but also thinking about racism in the US as a twin pandemic that impacts public health in very deep and disturbing ways. And in this context, I think that the uprisings of the past month since the murder of George Floyd, a Black man, by a policeman in Minneapolis, would not have been, the uprisings would not have been as long lasting or as widespread if it were not for the COVID-19 crisis. So Martin Luther King says a riot is the language of the unheard. And if we put this in the context of the very unequal and structurally racist system of employment and access to healthcare in the US, then I think we have to look at COVID-19 and racism really as two sides of the same coin. And I'm ending with a picture of the AFL-CIO headquarters in Washington, DC. The AFL-CIO is the highest labor body in the US. And this happened in a district that did suffer a lot of property damage. It may have been a coincidence that the headquarters were attacked. But I do want to point out just a piece of graffiti that says those who are silent are part of the problem. And I think that this is potentially a very direct critique of labor's response to protecting police as workers, but not protecting people and not historically organizing for these categories of workers who are left out with very little access to benefits, to healthcare. And so I will finish with this image, and I look forward to questions and to talking more about all of this. Thank you.
Thank you very much, Elizabeth. So we will now move to Anna Rosińska, who is currently a Marie Curie Fellow at the Ca' Foscari University of Venice and also a visiting scholar actually at the University of Massachusetts Lowell. Anna,
Here?
Yes.
Yes.
If you can share your screen, great, thank you.
Yes. Can you see it? Thank you very much. I am delighted to be here, not only because I see many familiar faces, but because I worked at the Center of Migration Research And it's great to see my old friends and colleagues and bring together also new friends and colleagues. So I will try to be brief because I know we don't have too much time. I want mostly to share my questions, and because as a researcher of domestic and care work, I am a little bit puzzled by the category of essential workers, how it relates to domestic workers. So I hope we can also like discuss it. I'm looking forward to like getting your feedback, because I believe that the sector of domestic work, so the work of nannies, house cleaners, personal caregivers, in-home personal caregivers, is a sector that actually shows a lot of complexities of essential work, and can be like maybe like a laboratory to think about the category itself. And this, the presentation of Elizabeth was greatly useful for my presentation. And I hope, you know, I hope to relate to it in my presentation. So first of all, just like a general thought, I was struck in the beginning of the whole pandemic situation, how universal, how there was like this universal construction of you know, stay-at-home orders, and everybody should work from home, like, you know, keep everybody safe, keep yourself safe. This didn't pertain obviously to people who had to go to work, who couldn't work from home, like some of the workers that Elizabeth mentioned. And so I like, yeah, if we look at the category of essential workers, you can find there agricultural workers, medical personnel, grocery workers, janitors, teachers, and maybe domestic workers. However, it's very debatable. And I was just reflecting on this that actually essential workers are essential for whom? For the society at large, or rather for 29% of American workforce who are able to work from home. Like Elizabeth said, white collar workers can work from home, blue collar workers are either deemed essential or are actually laid off, hence the great numbers of people who are currently unemployed. So we can like even, you know, ask the question, is it better under the pandemic to be an essential worker or not to be an essential worker, or be a non-essential worker? Of course, it depends, but I just wanted to point to the fact that being an essential worker for some workers can mean rights, privileges, and being like honored as heroes. But in some other cases, like meat packers mentioned by Elizabeth, it just seems to be equal to a right to be like, not right, but like a situation in which you are like exploited. So coming more to the area of care in general, or healthcare, these like there were many, like people are very critical of this heroes discourse, and they are like saying that, you know, we are called heroes, but actually we are not fitted, we are not like provided with any personal protection equipment. And there's this famous case of nurses in New York that were wearing like trash bags as their protective equipment. And just very briefly, I already mentioned people whom I consider to be care domestic workers, so nannies, house cleaners, and personal caregivers. But if you look at it more theoretically, there's a very inspiring definition of care work that can happen in domestic context or out of home. that care work following Duffy, Armenia, and Stacy is about building and maintaining human infrastructure. And it also sounds a little bit familiar. I would argue that currently we could argue that also all essential work could be considered care work, because actually essential workers do just that. They build and maintain human infrastructure. So I think there are several ways in which these both areas could inspire inspire like a joint reflection. And yeah, there are a couple of like characteristic, and there's a like domestic work is a very specific sector. Very briefly, it involves a very particular employee-employer relationship. The workers are isolated. Most of the times they are very, very scattered. And informality, so working under the table, is very widespread. According to data and estimates, there might be as many as 2 million domestic workers in the US, and the majority of them are immigrant workers and workers of color, and these categories are overrepresented in these types of jobs too. So now turning into how care work in domestic settings relates to COVID-19. So first of all, domestic workers cannot work from their own homes. They sometimes work with vulnerable populations. Think about personal caregivers who, tend to people who have underlying conditions, or like elderly folks. They often don't own a car, so they commute using public transportation, exposing themselves to contracting a virus. Many of them were laid off or lost some of their clients because, first of all, people fearing like being in contact with another person. Secondly, some of the employers who are these, 29% white collar workers who work from home themselves, they were like, okay, we no longer need a house cleaner. Well, we need her, but actually we can manage. Or some of the employers were being laid off themselves, so they found themselves in a situation they could no longer afford to pay for house cleaning. Yes, and they are being told to show up at work in situations that are not safe for them. And I know that I don't have too much time. However, I want to discuss two things. First of all, the organizations such as National Domestic Workers Alliance keeps underlining that it is important to recognize domestic workers as essential workers because they are excluded from relief policies, for instance, also in Italy, but today I'm talking mostly about the US. And you can read statements like essential frontline workers are the true heroes of America's COVID-19 pandemic response, which is within the HEROES Act that is being currently discussed at the Senate, I believe. I think so, yeah. And it's about hazardous pay. Moving on, recently there was can I have 3 more minutes, Marta? Will it be okay?
Yes, it's okay. 3 more minutes is okay.
So recently there was a very interesting survey done by a section of National Domestic Workers Alliance, We Dream in Black, who specifically focused on Black domestic workers. And in this report, as you can see, especially Black immigrant domestic workers, they reported many problems, and many of them, if you think about the fact that, I cannot really dwell on it, but it's shocking to see 65% of Black domestic workers reported being at risk of eviction. So because they are losing their jobs. So this is the situation. And in this context, I think we have to understand that organizations whose response was like amazing and very swift and multi-level are arguing for including domestic workers in the category of essential workers. I believe this is one of the only ways in which these workers who are vulnerable at the outset can have any sort of protection and access to rights. So for instance, National Domestic Workers Alliance is arguing for passing of the Essential Worker Bill of Rights, which is supposed to include domestic workers as well. Okay, and I would like to finish with a lengthy quotations from one of the participants in my study. This is a person who is 26. She is white, US born, non-Hispanic, non-Latinx nanny in Massachusetts. And she has a little bit a different perspective on essential work. So if you can read, if you can see it, I will just read the key part. So she's reporting her discussion that happens in her head or like directly with her employers who were working from home, or as you will see, not really, and continued to pay her and to come to work. So she's saying, and I was like, so you are exposing me to a potential risk so you can build a wine cellar in your basement? I think I'm not really an essential employee because neither of you are essential. So the situation, like she's referring to the dad in the family who was most probably laid off. The family claimed that they need her, but like he wasn't working. He was like, as we see, working like building a wine cellar in the basement. So this is another like thing that I cannot go into details about, like what are essential workers for other essential workers, like who is entitled to like get access to like daycare centers, for instance. Or there was I don't have time to dwell on this. I'm sorry, but I'm happy to develop it in the discussion. So the point I'm trying to make is really there are different, like among domestic workers and among domestic employers, there are people in very different situations. Some of the employers can still afford to pay workers even if they don't show up at work. Some of them are like laid off and they find themselves in a dire situation, like maybe not similar to the domestic workers, but also like, you know, they face like troubles. And it's really difficult for me to say, to answer like very clearly if domestic workers are essential workers, because some of them, it seems, are really essential. If you think about personal caregivers who sustain lives of, for instance, elderly folks or other people who need care on a daily basis. Others may be considered a little bit of a luxury, maybe workers who just enhance their quality of life, but are not really essential. So this is just a point I was trying to make, that it's a little bit more complicated, as we like to say in social sciences. Thank you.
Thank you very much, Anna. And I think this is also already a good start for a discussion, but we have still 2 more speakers. And now I would like to ask Cleovi Mousela from Bielefeld University, who is actually currently also a visiting fellow at Lancaster University, to share her thoughts with us on essential workers and the pandemic.
Yes, thank you very much for having me. And I'm actually very pleased and very glad to be part of this discussion. Let me just start sharing my screen. Part of my research has been about Filipino workers in Germany. So from the US, I'm going to take you to the German context, and I'm going to take you to nurses on the front line of COVID-19 care in German hospitals. So sometime late March, I was struck by the news, both from the Philippine and German online news sources, that a hospital association in Germany had a special permit to fly in 75 Philippine trained nurses to care for COVID-19 patients in German hospitals. And that happened despite the lockdown in the Philippines and European-wide restriction to travel to its territory, which was a fast-paced migration, and it was authorized. And this news, I thought, prompts us to view the pandemic also with a social science lens. So I agree with Anya saying that, social science matters in this health issue, or predominantly a health issue. And of course, this points to issues about migrant care work and the ethics of importing care, especially from an under-resourced developing country to a developed one, and from a country that is also facing the pandemic. So what I'm sharing with you today are basically, there are stories of Filipino nurses working on the front line of COVID-19 care in German facilities. And they, in fact, migrated through a bilateral agreement in 2013. And the main idea behind that agreement was to fill Germany's nursing shortage, and that nurse migration is beneficial for the nurses to themselves. But in my previous research on global migration of nurses, I've argued that nurse migration is in fact, it perpetuates the dispensability of care and the expendability of nurses on a global scale, especially if you're thinking from the movement from global south to global north. And the pandemic manifests the flaws of this system. So going back to the interviews that I've conducted with a colleague of mine, Dr. Von Vilo, they were conducted via Skype. And towards the end of May, beginning of June, so the time when the restrictions were slowly being lifted in Germany. And so I thought of, say, framing the talk today with stories that can provide insights into how migrant frontliners seek to make sense of diverse risks they face. And also for me as a researcher as well, they better account for nuances with in terms of materials which are sensitive. So I'll start with heightened precariousness of COVID-19 station. Given that nurses are responsible for primary care of patients, which means feeding, bathing, and helping patients move, there's a lot of physical contact. And they are nervous taking on the job, knowing that what they are facing is new and fatal. So basically, they have the corporeal experience of the intensity of coronavirus. And they ask themselves a lot of what ifs. What if I get infected? What if I knowingly pass it on? Which kept one nurse awake for 5 straight nights. So they keep asking themselves whether it is a blessing to be a nurse during a pandemic, quote unquote. And what if they die? What if what they are supposed to do? And maybe it is better to be a nurse doing what you're supposed to do around this time. So those are kind of like their the lingering thoughts. Nurses are aware of the risk. The risk of exposure is high, and they need to make sure of their own health and safety first. They take the necessary precaution as prescribed by their hospital facility management, and they also work as a team player to coordinate properly and avoid infection. And some of them have become obsessive compulsive, knowing that if they don't follow the protocol of the hospital of wearing and removing the personal protective equipment, there will be risk exposure. So down to the tiny little details of when to remove your protective gear, they have to be very cautious. The work is draining them in all aspects. So it's not only a physiological stress, but also emotional, mental. It's physiological stress because having the PPE on during their work shift makes their body really warm. So they've been actually complaining about that. Although they do receive support from the hospital they work at, except for hazard pay, which they have been complaining about. It depends on the state in Germany, but most of the nurses that we've interviewed, they don't receive the hazard pay. But they're given food and food vouchers. And the hospital also provides video instructions on how to properly wear the PPE and which mask to wear depending on which patient to care for. They say that they're given enough supply of masks, disinfectants, complete gear, free access to regular testing every day. And that sort of help frontliners feel less fearful as they care for each patient. Another aspect of precariousness comes with being a migrant, precisely because of the complex relations of care that connect individuals and families across societies. With coronavirus spread in different parts of the world, the dangers of caring at a distance become even more pronounced. So there's a question now of what it means to care when family members living apart across national borders are all exposed to the virus. There's the risk of dying far from loved ones or far from home. And so with the nurses that I've interviewed, one of their concerns is what would happen to their family back home if they die in Germany. Or one nurse says that they're supporting families back home. What if they die in Germany? Or the other way around of being far from home when your family or loved ones are dying. One nurse shared his story of contracting the virus. It was actually a very emotional interview, and it was a very emotional experience for him as well. So when he learned about the positive test results, he said that he did not panic, but he had so many questions, like what he should do, whether he should stay at home or whether he should admit himself to the hospital, whether he should move out of his flat, because he's sharing a flat with a friend of his. So he said, quote, "I was expecting the worst, but he kept his faith. He was literally alone, but being in touch through social media really helped him." He developed symptoms of coronavirus in the second week of quarantine. So that meant headache, fatigue, muscle pain, and he said it was the worst cuffs of his life for every minute. And he couldn't get out of bed. He couldn't cook. He didn't have enough strength to take a bath. And it was hell, he said. And he was afraid of running out of medicine because no one was there to help him. So his parents back in the Philippines, his friends and relatives, they were all worried, texting him every day. And yes, it was a very emotional experience for him. So for 3 weeks, he was dependent on a web of care composed of friends looking after him and doing the groceries, buying medicine. Local health department was also involved. They're calling him every day to check on his vitals. And as a healthcare professional, it is a must to inform the health department if you catch the virus to help track the spread. The transnational aspect of this web of care, for instance, in his case, he was able to share the story to his hometown community back in Cebu in the Philippines. So he was able to communicate with them and inspire others. That's what he said. That's what he used, the term that he used. And another transnational aspect of this web of care, for instance, one nurse on the front line of COVID-19 care, he could not inform his mother living in Manila about his decision to volunteer as a nurse in a COVID-19 station because he knew that his mother would be worried and he knew that she would be angry. So he told him only after a week of working. And at that time he became confident that with his double protective suit, with a visor, with a face mask, with gloves, they would be enough to keep him safe. Although, of course, he was always nervous going into the station. So when he finally told his mother, she could not sleep. She was obviously worried of him. And then when he sent her pictures of him wearing the personal protective gear, she would compare it to images of what she saw on TV, for instance, from China, where healthcare workers are covered from head to foot, while nurses in Germany are, having just a visor and face mask. But this nurse said that he trusts the system. So he had to explain that the standard in Germany makes him like really sure that he feels actually safe working at the station. And he knew which patients tested positive. So with his knowledge, with his medical knowledge, he was able to protect himself and make his mother calm down in a way. So one last story would be about status in the hospital. So one nurse, for instance, when he volunteered, he thought that nobody would volunteer in a COVID-19 station. He didn't expect that there would be a lot of volunteers, in fact, from nurses from other stations. And he felt that this was making a significant contribution to a major public health crisis, and it has made an impact on his identity and sense of belonging, at least in the hospital. And he feels stronger as a person as he's been through this crisis. He also feels like an expert in handling suspected cases, as his colleagues consult him in terms of swab testing, for instance, whereas pre-corona times, he was simply a newbie. He was simply, colleagues did not really seek his opinion, but now that he has the experience, he kind of feels he belongs to that workplace. We're still not talking of society as a whole, but perhaps it's something that we can talk about later. So thank you very much. That's all on my part.
Thank you very much, Cleovi. Now, last but not least, of course, Kamila Fiałkowska from the Center of Migration Research at the University of Warsaw, please.
Thank you very much, and thank you everyone for joining us today. Thanks Elizabeth, Anya, and Cleovi for those presentations, because you already raised a lot of important points. And well, being the last is kind of also always very stressful, because I don't want to be repetitive. And a lot of things that you said also relate to the farm working, to the agriculture. But yeah, let me try to discuss the essential workers paradox in the agriculture. I don't have a presentation, so you just have to bear with me and listen to what I'm saying. I titled my talk "The Conundrum of Essential Farm Workers," and I would like to look back at what was happening in the agriculture for the past couple of months, and to touch upon some of the paradoxes of this essential workers discourse, and I will try to break it down to you in a moment. I will be talking mostly about Germany with some reference to Poland, and when necessary, I will build on my own experience as a former seasonal migrant farm worker in Germany. So let me begin with stating the very obvious facts. So the beginning of the pandemic in Europe coincided with the beginning of the intensive work in agriculture, and soon the harvesting season began. So when the lockdown was introduced, the farmers were awaiting for the seasonal workers to come to do the work in the farms, in the fields. Obviously they couldn't come because usually they don't live in the country where they work. They live in Poland, in Romania, in Bulgaria, or as far east as Uzbekistan or Mongolia. So the countries that were waiting for those migrant farm workers to arrive started to search for some solutions. So for instance, calling to local populations to help feed the nations. The campaigns were kind of started in the local media, in the internet, or Pick for Britain, or the country helps together for the agriculture and us all in Germany. At the same time, the National Farming Association started pressing the government, and what's happening in Germany, for instance, and the Ministry of Agriculture to provide solutions, some fast-track solutions, to actually allow seasonal workers to come and work in the field. And they realized there was even a petition started by one of the farmer, and other people joined him. There was a petition stating exactly that annually the farmers need some 300,000 workers, and not just workers, they need 300,000 Eastern Europeans, for which they only could harvest their crops with some 600,000 workers from Germany. So basically, Eastern European worker is a value on the market. Very soon, during the lockdown, very strict lockdown in many countries, such as Romania or Poland, exemptions were made for those workers who are deemed essential, yet seemingly can afford to take risks of mobility. And overall and significantly, for the first time after the onset of the COVID-19 crisis, farm workers, and in particular migrant farm workers, have been recognized as essential. Essential, but also disposable. And how does that happen? We could talk a lot, and maybe in the discussion, there will be a chance to dig more into it. I think that temporariness is the key, because they only come for a couple of weeks or for a couple of months. But it also is combined with other categories which work intersectionally, strengthening this asymmetrical relation between the employees and the workers. And so the other categories are gender, age, ethnic, and national origin, family status, and many more. So we could observe how the essential workers paradox show in practice on many occasions. In the news, for instance, we read that the farmers are relieved because the people arrived to help feed the nation in what has been labeled by some as corona-free operation. Soon, there were inevitably cases of coronavirus infection, but the press explained that strawberries are safe. There was little public concern regarding the exposure, for instance, in the social media, of the poor living conditions and the very fact that the social distancing measures on the farms are really not possible to implement, and they're pretty much fictitious. And just recently, I learned that there's almost 100 cases in Bavaria of people from Poland, Bulgaria, and Romania tested positively for COVID-19 in one of the farms. But then again, we read that some of the workers exhibited symptoms before coming to Germany, so that we also observe how there is, the burden of responsibility is shifted onto the workers, while keeping the employers out of public attention. And one of those very, very significant event happened in mid-May, where we also saw how this paradox works, how the essential workers paradox work in practice, was the farm workers strike in Bornheim. And I don't want to go into details because there's a lot of things that needed to be explained. But in general, very few farm workers go on strike, at least in Europe. Usually they endure harsh working conditions, temporarily leave their right to have rights, which is then often also used against them as they supposedly contribute to those substandard living conditions and working conditions in the agriculture. But one important thing is that during this very severe lockdown in Europe, the company that employed them was insolvent, and somehow this fact was neglected during the recruitment and contracting of the workers under the exceptional circumstances. And at the time when there was already charter flights coming from Romania to Germany, for instance, Polish Minister of Agriculture appealed to solidarity of Polish people, to also help Polish farmers, in this case, with their harvesting. He also appeals to the John Paul II and his Catholic teaching to support one another at the time of crisis, which is very important. And so everyone should drop whatever they're doing and just go to the fields and pick some strawberries. And then there was also this funny argument used that actually after the lockdown, it will be quite healthy to go to work in the fresh air. And obviously, the farmers, just like the farmers in Germany or in Great Britain, realized that they cannot really count on homegrown labor. but they need to push for also some fast-track solutions. Soon in May, when the Polish consulate in Ukraine reopened, and so the farm workers who were also waiting this moment to come to Poland for work were able to obtain the documents to come legally and work legally in Poland. There were disputes between the farmers and the Ministry of Agriculture concerning the regulations that were imposed on farmers if they wanted to hire the foreign farm workers. They considered those regulations as too tough, especially the requirements regarding the accommodation, the quarantine, and obligatory, in case of Poland, COVID-19 testing for the farm workers. And regarding this, the whole conflict was about the cost. Who will cover the cost of the testing? At the beginning, initially the minister would say that it is in the interest of the farmers, so they should bear the costs. And finally, by the end of May, the Minister of Agriculture agreed that the farmers will be relieved of this cost, and which probably then would be shifted on the workers anyway, but that the state will cover the cost of the testing of the farm workers. And it was said that it was due to the positive, good cooperation between the ministries and the solidarity of the state agencies with the farmers. Another important, but one of many exceptional things introduced in Poland by the so-called anti-crisis shield was to allow employers to extend the working hours and limiting the resting time of the workers. So in agriculture, that basically means that the working conditions, which are not great anyway, are potentially, will potentially become even more exhausting than under regular circumstances. And finally, I'm nearing to the end. I started to think that all the special rules and exceptions in agriculture and to employment of farm workers are not possible because of the realization how essential farm workers are to agriculture. Because I think farmers already knew about it before the pandemic, long before. But because of the fact that exceptional rules apply to agriculture under regular circumstances anyway, or under normal circumstances, as some may say. So there's this agro-exceptionalism, which is an exceptional policy making for agriculture under regular circumstances, but also they extend to the exceptional times, such as current pandemic. So these were the charter flights with the farm workers brought from other countries to Germany during the lockdown. No need for quarantine or allowing people to work during the quarantine. Obligatory COVID-19 testing for the foreign farm workers. So this is this belief that there's a need for exceptional rules in particular field. And this has been also justified by special narratives built around it. And one of those special narratives was reference to nationalism or patriotism. So in this discourse of agro-food production and food security, there's this duty of the nation to protect and secure homegrown produce. So come and pick for Britain, but it could also be come and pick for Germany, pick for Poland. But if you cannot pick, then let others, the foreigners, come and pick for us. And this is where this exceptionalism operates and deliver a secure and safe food supply in the time of pandemic. And these exceptional rules apply also to working conditions, to living conditions, contribute to low pay and precarity of the farm workers and their abuse and discrimination. It has tremendous impact on their health also, not only immediate injuries that they have in the field, but also long-term effects after such work which is performed for many years by some of the workers. And by the rule of exception, it is also easy and sometimes too easy to say that agriculture is specific and difficult, and we have very little overview of what is going on in the field in general, and what is the situation of the farm workers, because it is hard to reach population. And it is true, but it's also not impossible to reach them and to learn what are the conditions. So I wonder if, finally, if agriculture benefited from the essential workers rhetoric or discourse. And I would say that it has, as it delivered them essential hands for work during the pandemic and lockdown, with lessened social and paradoxically health protection measures as a rule of exception. And maybe I'm naive because I thought initially that this discussion on essential workers seemingly aimed at appreciating and looking with empathy on essential workers with aims to better their situation, working conditions, increase their payments. But instead in agriculture, it has been used as a tool to normalize the rule of exceptions. For example, low wages and exploitations. And so there is a need to work in the direction that this essential worker discussion will actually have a positive impact on the farm workers' condition and will not normalize this rule of exceptions. And in light of all that, and knowing that agriculture is work intensive and exploitative to migrant farm workers under regular circumstances, with fewer workers in the field, the working conditions are likely to be even more exploitative. So there's an increased pressure on workers to intensify efforts, work longer hours with no days off, etc., etc. And also inevitably there will be a recession following the pandemic, which will impact the rights and protection afforded to the workers in general, and I'm afraid to migrant workers and farm workers in particular. And I will finish on that. Thank you.
Thank you, Kamila, very, very much. That was a very powerful final speech right now we had. Great. And thank you to all of you for all your speeches. And we already have a first question from our participants, which is, I would say, a broad one, but how can we transform language of science into language of solidarity and social change? And how can we basically make migration studies more and more involved into creating a more inclusive society? And so here we have one question. I also encourage you, if you want to respond to your own speeches, I have a few questions, definitely. It was highly inspiring for me. And I also encourage very much other participants also to pose questions. Is there anyone who would like to start with either responding to your own talks or to the question that was just posed? Okay, go ahead, Anya, please. Just unmute yourself. And...
well, I'm just a little bit overwhelmed with inspirations. Thank you so much. It's a food for thought yeah, I cannot really process it right now, but I would like to really shortly reply to this call for solidarity. While I was listening to your presentations, I kept thinking in the back of my head how maybe we as social scientists, or people who are operating in the field of labor studies, could come up with our own definition of essential work that would be that would be about valuing the work that is really basic, and that would acknowledge and recognize the hazards, the risks taken by workers. And maybe this could be some kind of a start to counteract the practices that Elizabeth mentioned and that Kamila mentioned, that basically essential workers are a label used to force people into exploitative situation. That's one quick reply from me.
So my academic training is actually not as a social scientist. Surprise. My PhD is in literature and the history of science, which I think gives me a different kind of perspective, but one that I think is still useful. And for me, the answer to this question about how to translate the language of science into a broader call for solidarity is really about telling stories and amplifying voices of those whose voices are very deliberately politically pushed down and silenced. And so the more opportunities that we can provide for not just telling other people's stories, but that very visceral power of someone telling their own stories and providing avenues for that, for me, has everything to do with why I do the kind of work that I do. So.
Thank you very much. Sure, Cleovi, go ahead, please.
Yeah, just one quick thing, just to follow up on what Anya and Elizabeth already said. So I think the power of stories would be because they're more about nuances. So they look at differences in terms of narratives and voices of different people from different background. And I think social sciences already has, for instance, intersectionality lens, for instance, what we could use. Or I've been reading social reproductive theory, for instance, and how it could be useful in the time of pandemic. So I think, at least for me, those are quite useful starts, perhaps, to talk about social change in a way. So that's what I've been reading nowadays, and that's just my reflection and my thoughts for the moment.
Thank you very much. I don't know if Kamila wants to react, or there are more questions coming up, so I can also...
Just very briefly, there's quite a lot of inspiring examples of solidarity among the activists, farm workers, and also researchers, and they're coming from the US, for instance, or some of them are from Italy or Spain. And sadly, what happens in Central and Eastern Europe has been very much omitted, and there's a lot of work to be done. Mostly because it's also a new territory that is undergoing a massive transformation when it comes to mobility and migration. So therefore, it's kind of, I think it's important to learn to watch what is happening there, and also try to implement some of the solutions to, I don't know, to raise awareness, to pressure the supermarkets and produce buyers, to raise awareness about, for instance, Operation-Free Foods, which is very much developed campaign in the US or in Italian and Spanish context. So some of those things we can take an inspiration from, I think.
Okay, thank you. There is a question from Marta Jaroszewicz, who actually developed the term essential workers, and how does it influence power relations in COVID societies? I think that was discussed a moment ago to some extent, but I'm not sure if any one of you can answer. Is there any one author of the term essential workers?
Well, for sure, it happened to be in the European Commission papers, but I'm not exactly sure how it's started to be widely.
Actually, I'm also not that sure. There is a question as well to Elizabeth here. To what extent the protests after Mr. Floyd's tragic death that have spread around the US have been also affected by the disproportionately difficult situation of the Black Americans during the pandemic, health and economic-wise?
Yeah, thank you for that question. I think there's absolutely a very direct connection between the two, although you don't, when you go to the protests, and I've been to several now, the signs that people are holding are not about, they're not about work directly. But I think that I would say that there is kind of the same root cause, and that people, one of the statistics that Anya pointed to in terms of, this skyrocketing number of Black domestic workers who are facing eviction and utility shutoff as a result of the pandemic. I think that people are more desperate. I think that the kind of stratification and inequality is like increasingly more and more obvious, and this has really provided an incentive. I think that there would have been protests in any case, but I think the fact that there has been conversation in the media, and it's been interesting. So thinking about in March and April, a set of stories comes out in the national media about the fact that COVID is impacting communities of color more harshly. and people are interested in thinking about why. And there is a risk, particularly in US society right now, about kind of reading like a biological essentialism of race into that question. And so there was a backlash, and maybe this is also kind of an answer to the question about the role of social science right now, in saying, no, actually, this isn't about a fundamental genetic difference between races. This isn't a genetic concept. This is a socially constructed concept, and saying that it has everything to do with the working conditions, the kind of work that people are exposed to, the kind of housing that people are in, and the impossibility of doing that. And so I think very broadly, I would say that although it may seem that they're not directly related, I would argue that they very much, the uprisings are very much stemming from this peeling back the layers of inequality, particularly as impacted by race and ethnicity in US culture, as a very much driving and sustaining force for those uprisings to continue. And we've also seen, I think, in one hopeful note, we've seen more white people in the US joining in those protests than in previous cases. For example, when Michael Brown was killed in Ferguson several years ago, while those protests were ongoing, I think that there's a much broader swath of society who's now willing to participate and willing to speak up, and recognizing that not only is police brutality an issue that impacts people of color, but also there are maybe just a broader understanding of the mechanics of structural racism in society as a contributor to public health.
Thank you very much. There is a question also directly to Anna. I was wondering if comparison, the new notion of essential with other cases of exemption from labor rights, like the right to a strike, could be analytically useful.
Thank you for this question. I don't know if I'm really qualified to answer that, so I'm happy to have other people jump in. My first thought was that the way I'm reading this question is treating the category of essential workers as a way of like silencing the workers. So you have to show up at work because you're essential, and like basically be happy that you still have a source of income. And but really, like, there's not too much room for like fighting for your rights or like having your like safety protected. I don't know if that's where Anna was getting at. Maybe she can clarify. I can try to answer better, or maybe some other people have other ideas.
I can speak briefly to that. I think that's, oh, I'm sorry, go ahead, Anna.
No, I just said, please go ahead. I think that Anna didn't say anything, that was me.
Okay. So I think that there is a way in which workers' campaigns have certainly taken this notion of we are essential, as I think Kamila was speaking to a little bit, of who is an essential worker. We are essential, and therefore we are going to have the following demands of our employer. And I think that that has been useful on the workers' rights side to some extent. I know that here in Massachusetts, a year ago now, a year and a couple of months, I've lost all concept of time since the pandemic began. There was a very widespread strike of grocery store workers, whose employer was trying to roll back certain benefits like time and a half on weekends. And those workers received hazard pay at the beginning of the pandemic, and a bump in their salary of $2 an hour, something like 10%. So a significant bump. And now we're seeing at the beginning of July, the employer says, well, things have loosened up enough. You're not really essential anymore. You're still essential, but we're going to roll back the hazard pay. And so there is a very interesting campaign among those workers to say we're still essential, we're still in crisis mode, and you can't take away our hazard pay that quickly because we are still at risk, and particularly in the U.S. There is actually a risk. We're hearing more and more stories of workers being attacked on the job for insisting that customers wear masks into the place of business. And so I think, it is this kind of like double-edged sword of, if you're going to call us essential, then you need to follow that up with benefits and with meaningful remuneration. And I'm so interested in the case that Cleovi is talking about with the Filipino nurses and thinking about what kind of incentive makes it worthwhile. Am I correct in assuming that they were able to choose whether they would come to Germany or not, the Filipino nurses? So what is the incentive that makes that worthwhile?
Nowadays, that's not possible, in fact. So, it's not possible to move to Germany and take up work because of the lockdown and because the outmigration and it's been suspended doing bilateral agreements at the moment. There's been like a talk nowadays because in the Philippine context, it's pretty interesting because the outmigration has been part of, or the export of labor has actually been part of, let's say, the culture and of outmigration in the Philippines that's been going on since like 1970s. And so people have been, especially nurses, they have been expecting work overseas. So during the pandemic, it's not necessary, it's not possible. And the government has restricted, in fact, conducting bilateral agreements and restricted nurses, particularly moving out of the country. So the one when I started my talk earlier, that was like the last attempt, in fact, to import or to export nurses. Yeah, but since we're talking of strikes, with the interviews that I've conducted here too in Germany, they have been trying to ask for hazard pay. So there's been a lot of debate that nurses are, I think they call it here, systemically relevant. So more like a term of essential workers, right? The idea of essential worker that they cannot not go to work. So they must go to work, but then they don't have the hazard pay, and it's sometimes just a bonus, or it depends on the stage. And they're low paid. So they've been really, I think part of the debate among healthcare workers is that now is the time to pressure the state and the government to act and to give them the proper benefits and proper remuneration.
Just one really quick follow-up. I know I'm speaking a lot, but
go ahead, please.
There is a sort of backlash to the notion of hazard pay among industrial hygienists and people who do health and safety work in the US, and the conversation being there is no amount of money that we shouldn't be calling it hazard pay to begin with, because it ends up quantifying a risk to self and family, and that it's a very dangerous line to walk, to say, yes, we want additional benefits. At the same time, we have to be very careful about how we employ that terminology and say we can put a price tag on the kind of risk that some of these workers are taking, particularly if they don't have access to personal protective equipment.
I wanted also Anna Horolec to join us for a moment, who asked actually the question to Anna before and who said that she would like to add a sentence or two.
Thanks a lot. Well, first of all, I just wanted to explain my question is out of ignorance because I do not know very much about these exemptions from strike, but I know that some professions just cannot strike as other professions do because they are considered some kind of a job of essence to public and so on and so forth. The policemen, I guess, the firefighters, or I don't know, the teachers probably. So I was just thinking probably if you know how these exemptions work analytically, that could be comparable. I was also thinking that in the context of mobility, the diversity of those essentialities are quite core, because in the context of Brexit, the essential workers could be a pathway for the exemption from the point-based system, which was discussed recently. And here again, when lockdown in the UK was beginning, as you probably remember, their schools were open and some professions were qualifying for their children to go to school. And actually, the lorry drivers, the people who are delivering things, they were not included in these professions, which means that, like, within the category, is quite important, and that therefore it's wonderful that Elizabeth has spoken about prisoners and people in meat packs. We talked about nurses and farm workers and domestic and care workers, because they might all be quite different categories of people. And this is my little contribution. Thank you.
Thank you very much. There is, I don't know if you want to react to it as well, but because there's another question actually to Anna and Cleovi, so I can follow with that then. Okay, will there be increased demand for care workers to increase the staff of care homes, hospitals, childcare centers? And can the increased demand and realizing how essential they are for running these institutions lead to improvement of the situation of immigrant care workers? Of course, together with draining the sending countries more. So I don't know if Cleovi or Anna would like to start or respond.
Please go ahead, Cleovi, if you want.
Okay, I'll try. I've been following the debate here in Germany in terms of demand for healthcare workers. That's why I think there was this, the special flight that I mentioned earlier at the beginning of my talk. So that was like one sort of sign that, you know, there is already a demand, and since 2013, as far as my research is concerned, it has Germany has started recruiting internationally, and that's, I think, one of the problems, because they've been looking outside, so they've been looking for like migration as a solution, but I still have to hear what the country is doing at the moment within its own borders, let's say, in terms of education, in terms of recruiting nurses within the country. But of course, there is increased demand, definitely. And as I mentioned earlier, locally hired nurses are actually using this pandemic as a moment to demand for more protection and for proper remuneration, respite, and decent pay or decent care, decent work. But yeah, I still have to look at like what's happening really. For instance, not looking at migration as a solution, but within its own system, like of education or training new nurses, for instance. But the shortage of nurses has been let's say a problem in the German healthcare center.
Anna, I know that you wanted also to respond, maybe to share some reflections on how we should change our language in science. So please.
Yeah, but I'm happy to also address Veronica's questions. Thank you very much for that. Actually, I discussed this issue with my host professor here, Minyan Duffy, and she said it was inspiring to hear from her that some people actually think that there will be an increased demand for in-home care rather than institutional care, if you take into account the fact that among currently 8,000 deaths from COVID-19 in Massachusetts, as of today, more than half of these deaths were in care facilities. People are increasingly scared of, institutional care. So those of them who can afford it, we can expect that people will opt for in-home care more than before. This will be, of course, a very polarized phenomenon based on, of course, the affluence and what anybody can afford. So this is one thing. Secondly, I have seen, because I also I'm trying to reach out to people who are called here personal care assistants or aides. I have seen a lot of job offers in this particular sector, and these offers were both for in-home and in-home care and institutional settings. So it seems that this sector is like, it is always like hungry for new workers, but at the moment it's even more like the workers are even more in demand, probably because of a higher workers like turn. I forgot the term in English. So people like get sick, so they need to be substituted with other workers. And I was also very inspired to hear about what Kamila was saying and what Cleovi was saying, that actually this whole situation can be an opportunity for improvement of working standards, because based on what I see in the sector that I study within domestic workers here in the US, it's mostly like what I would call like a survival strategy. So trying, people are like laid off on a mass scale. In this situation, it's like, of course, it would be great to have better working conditions. However, I don't know if really people who are facing evictions, again, can afford to like fight for it. I'm not sure, maybe Elizabeth has a different view on this. However, there was the organizations of domestic workers are mostly focused on promoting very basic things. However, they also from time to time remind people that the problem with domestic work in the US is that there are no really federal guarantees of workers' rights, and they reiterate the call for passing Domestic Workers' Bill of Rights at the federal level, because so far only, I believe, 11 states have passed Domestic Workers' Bills of Rights, and it is not a universal thing. So not in all of the states, in the minority of states, domestic workers are included in labor regulations. Yes, and yeah, I will just, yeah, I have a very minor thing about the solidarity, but I think it's better to.
All right.
To others.
Thank you. Okay, we have a final question actually from our participants, and then we will wrap up. A practical question. I'm curious, what would be your advice in how to take a more active role in advocating for better protections for workers, both those officially deemed essential and those who simply have no choice? Any of you share your reflections on that?
I could speak to that a little. I'm not sure how useful it is outside of an American context, but a couple of things spring to mind, and one of them fits exactly with what Anya was just saying about, you know, we have these federal protections. There's also an opportunity at the state and even at the municipal level to advance reform and labor law, you know, in terms of things like wage theft, issues at the state level, like who is protected and who is carved out of labor law, who is able to form a union. I think one other thing that I might mention is, and I alluded to this very briefly in my presentation, but even recognizing many of us are employed by academic institutions that employ very different standards for different types of workers. So one very basic thing to start with is looking at who has what rights in the workplace, in your own workplace, and looking at who is subcontracted out, who is expected to report to work, and what kinds of benefits and pay are those folks receiving. I'm not sure about European institutions, but I know in the US, you know, we have separate unions for separate categories of workers in the workplace, and those unions are treated very, very differently. In fact, my own institution, so I mentioned the cleaners weren't receiving masks or protective gear, and the university said, well, you have to have them to go to the grocery store anyway, so just bring them from home. But when the labs began to reopen for workers to come in and do, you know, engineering, chemistry, the sciences, those workers were going to be provided with protective equipment, and they were going to be given other kinds of benefits. And they were able to speak up and say, well, it really doesn't make any sense and it doesn't protect any of us if we all have equipment, but the workers who are coming in to do the physical cleaning don't have the same access to protective equipment. That actually puts everyone at risk. And the employer then quickly shifted and said, oh, okay, this is a public relations nightmare and we're going to start supplying that. So even something as small as looking in your own sector can be very helpful.
I can briefly relate to the agriculture and some of those things I already said. But there are some positive examples of advocacy and support for the farm workers. But in general, it's very, very difficult field, right? It's not impossible because we've seen those positive examples and we have observed what happened, for instance, in Germany, in Bornheim. But why the majority of the population doesn't know and doesn't really care what's happening in the agriculture is that the work is performed outside of the, you know, regular life of your regular commutes. It's in the field, it's in the peripheries. You would have to go there and check, and it takes time and effort, and you would have to have your transportation because the villages or little towns where the farms are not very easily reached by the public transport in Poland, for instance. So a lot of those things are happening outside of the public eyes, so to say. So that's one thing. And for instance, in case of Bornheim, when the strike started, it was by coincidence that the local radio broadcasted about there is something going on in one of the farms. And then the workers' union members heard this radio broadcast. And that's how they all started, you know, going there and supporting the workers from beginning to the end, so to say, and assisting them in negotiations with the employers, and getting their wages paid, and not being sent back to Romania without any money. So all those things happened sort of by coincidence, and I think it's very, very disappointing that we actually wouldn't even hear about it if not this coincidence. So that's something systematic in the agriculture that needs to be addressed also.
Thank you, Kamila. We have here a comment as well from Agnieszka Dziwinowicz-Czubna, who says we should not be speaking about essential workers. It is just the work that is essential. So this is also a final food for thought. And actually, just to wrap up, I would ask you also maybe if there is one thought or one comment you could give, what can we take home from this webinar? What can we reflect upon when it comes to essential workers or workers who do essential work, now referring to Agnieszka's comment, and the pandemic?
Well, I think it's in agriculture. It's used to, as I said, used to normalize the rules of exception, and we already knew that the situation is really dire there, and there's a lot of exploitation going on under so-called normal circumstances. So with pandemic, there's nothing unusual actually. The pandemic just exacerbated existing problems, existing inequalities. And yeah, the fights of the workers is very difficult because of their time they spend in the country where they work, because they are divided by the I don't know, national and linguistic barriers. So it's very difficult for them also to self-organize, to organize strikes. So that's my final, very pessimistic, I'm afraid, thought on it. But the pandemic just works on existing inequalities and just exacerbated them.
Elizabeth, Cleovi, go ahead, please.
I think what we've done today has been to make visible the different narratives of workers from different sectors, and also the kind of web of care that they're a part of. So it's not just, you know, workers themselves, but also their how they're related to like to their families or communities, and also I think it shouldn't really have taken a pandemic or a catastrophe that to realize that societies cannot simply survive without work or reproductive work or care in general. So yeah, that's like my final thoughts.
Yes, I think my final thought, my takeaway is very similar to what Kamila said, that this is, and Cleovi also, is that this is, you know, we hear a lot of people talking about the new normal, and this is not new. It's not normal and it's not new. And that this is also exposing not only the inequalities and the problems in our society, but also, I would say, in our labor movement, and the kind of lack of a transnational labor movement, and the deep importance of doing that work in the context of migration and building solidarity across borders rather than dividing, pitting workers against each other.
Just very quickly, if I can.
Of course.
One thing that I'm taking from this webinar is I just kept thinking that it's really beyond like labor issues, even class warfare. It's a very fundamental thing that is happening, and it's a big word, but I think that like what kept like popping into my head was like, what is moral, what is immoral? And I feel that a lot of things that we discussed today are simply immoral, and that's something that I'm taking.
All right, thank you so much. That was a great webinar, at least for me. I took out of it a lot of thoughts, a lot of reflexivities. I would like to, I would like to end the webinar for now, and thank you again for your active participation. Also to the participants, thank you a lot for being with us, and I hope to see you soon during our next webinar. If I'm leaving this space open, so if someone would like to continue now a discussion, you are very welcome to, but the official part right now I'm finishing and I'm stopping the recording.